So my next guest and I both serve on Congressman Langivin's Senior Advisory Committee together. I would like to welcome next Helen Mulligan from CMS. That stands for the Centers for Medicaid and Medicare Services. Welcome, Helen.
Hi, Deb. I'm happy to be here today to participate in the Rhode Island Virtual Senior Resource Fair. Today I am going to present some slides on the following topics: Medicare open enrollment to include Rhode Island specific information and resources. I will discuss the importance of getting a flu shot this fall. I will also address some Medicare COVID-19 topics. And after the presentation, I will provide some closing remarks. Just wanted to say one thing that this year is the 55th birthday of Medicare. And today there are currently 62 million people enrolled. And in Rhode Island, there are 224,000 people on the Medicare program. Can you start the slideshow, please? Medicare open enrollment is the time of year when people with Medicare can enroll, disenroll, or switch their Medicare Advantage or prescription drug plans. It's an opportunity to find health and or drug plan that works best for you. Open enrollment starts on October 15th and ends on December 7th each year. Any changes made during this time become effective on January 1st. Next slide. Each year, Medicare plans can make changes to their costs and coverage. Plans are responsible for informing Medicare beneficiaries about these upcoming changes. They can do this either by email or, if requested, by an electronic method. Plans do send 2 documents. One important document is the Annual Notice of Change, which we refer to as an ANOC. And this includes information on changes in coverage or service areas that become effective in January. Plans should send out this annual notice of change by September 30th. Medicare beneficiaries should already have received this notice. If they haven't, they should contact their plan. Plans also send out explanations of coverage, which give more detail on coverage and costs, and this notice should be received by Medicare beneficiaries by October 15th. Next slide, please. In Rhode Island, there are 26 Medicare Advantage plans available for 2021. And there are 27 Medicare prescription drug plans that beneficiaries can choose from. The average cost of a Medicare Advantage plan premium in Rhode Island has actually gone down $2 to $25.03 in 2021. Rhode Islanders will also have access to a Medicare Advantage plan with a 0 monthly premium. The lowest premium for a Part D plan will be $7.20 a month. Next slide. I do want to point out 2 new items of possible interest. For those of you on Medicare who have diabetes and use insulin, new in 2021 is a Part D senior savings model. And seniors who use insulin will be able to choose a plan in their area that offers insulin savings. Participating plans provide coverage of a broad set of insulins, each for no more than $35 a month. There are 9 standalone Medicare prescription drug plans and 13 Medicare Advantage plans with prescription drug coverage that will offer low out-of-pocket insulin costs through the Part D savings model. And starting in 2021, people diagnosed with end-stage renal disease may join a Medicare Advantage plan. In most circumstances, this was not allowed in the past. So where do you get plan information? One source is a Medicare handbook. The Medicare handbook is mailed each fall to beneficiary households unless they've elected to have the handbook sent electronically. CMS began mailing this handbook out to people with Medicare in September, and most should have received it by now. If not, they should be receiving it by this week. In the back pages of this book, there's state-specific information on the available prescription drug and Medicare Advantage plans. And you can use this information for a quick comparison. It isn't comprehensive information, so you can also check with the plan's website or call a plan for more information. Another resource to find plans in the area is a Medicare Plan Finder. This is an online tool where you can search for plans in your area. Next slide, please. One great resource during open enrollment, or in fact, really any time of year, is the State Health Insurance Assistance Program, SHIP. The SHIP offers one-on-one counseling and assistance to people with Medicare and their families. I really can't say enough about the great services that SHIP counselors provide to people in their community. This year with COVID-19, it will be different. And a lot of cases, individuals will be receiving counseling counseling help via telephone, or like we're doing today, some type of video conferencing. To reach the SHIP, you can dial 1-888-884-8721. You can call the point. Next slide, please. 1-800-Medicare is also a resource where you can enroll or change plans. Just some tips. If you're calling 1-800-Medicare and you have your Medicare number available, say Medicare number when you're prompted to do so. And if you have your Medicare number, there are a number of self-service opportunities available in the automated system. And self-service will allow you to get information quickly without speaking to a customer service representative. But also, if you've entered your Medicare number and you want to talk to a customer service representative, that will already be in the system when you reach an operator. And you can say agent at any time during a prompt to try to speed up the process to talk to a customer service representative. 1-800-Medicare service is available 24 hours a day, including weekends, except for these holidays: Memorial Day, Independence Day, Labor Day, Thanksgiving Day, and Christmas Day. And if anyone needs help in another language, you can let the service representative know. Support is available in more than 250 languages. Next slide, please. Now I want to talk about getting a flu shot. This is no ordinary flu season. It's a flu season amid a pandemic with two dangerous viruses going around at one time. It's time for us to protect our communities by getting the vaccine we already have, the flu vaccine. Getting vaccinated for the flu this fall is more important than ever. Not only will a flu shot help keep you and your family healthy, it can help reduce the strain on our healthcare system and keep hospital beds and other medical resources available for people who may have COVID-19. According to the Centers for Disease Control and Prevention, there's no evidence that a flu vaccine increases your risk of getting sick from coronavirus, like the one that causes COVID-19. Those at high risk for flu complications include young children, pregnant women, and people aged 65 and older, and people with certain chronic health conditions. The CDC does recommend anyone who is 6 months or older get a yearly flu vaccine. Medicare Part B covers one flu shot a year, and you pay nothing for the flu shot if you go to a doctor or other qualified healthcare provider that accepts Medicare payment. The flu shot is available at most healthcare provider offices, local pharmacies, health centers, and other places in the community. So do urge you to get your flu shot. Next slide. I'm just going to go a little bit over some Medicare and COVID-19. Medicare covers tests for COVID-19, and you can get tested at doctor's office, local pharmacies, drive-through sites, and other locations. And there is no out-of-pocket cost for these tests, and Medicare will cover more than one test if ordered by a doctor or other healthcare professional. Medicare will also cover the COVID-19 antibody tests. At this time, there's no vaccine for COVID-19. However, Medicare will cover a vaccine once one becomes available. Let me talk a little bit about telehealth. Previously, telehealth was a very limited service provided. It's only at certain locations and primarily in rural areas. Ever since the public health emergency with COVID-19, telehealth services have expanded greatly. You now have access to telehealth beneficiaries have access to telehealth services in a variety of places, including their own home. There's a wide range of communications tools that can be used, including smartphones. They can interact with your providers, like doctors, nurse practitioners, clinical psychologists, and more. During this time, you can receive telehealth visits for common doctor visits, mental health counseling, preventive health screenings. It's just a huge expansion of telehealth that really allows Medicare beneficiaries to visit their doctor from home. And for those who don't have access to internet and don't have a computer, Medicare will pay your doctor for services conducted over the telephone. There have been numerous waivers and flexibilities, including Medicare Advantage plans and drug plans during COVID-19. And, this is really to remove barriers that can prevent and delay beneficiaries from receiving care, and also to make sure beneficiaries get their needed prescriptions. I'm just going to mention a couple, but for those enrolled in Medicare Advantage plans, Part C plans, under the emergency declaration, if a beneficiary needs to go to a hospital or a medical facility that's outside their plan's network, in most cases, this will be covered. This is not just for any, this is for any service, not just if the beneficiary thinks they have COVID-19. A plan must also provide the same cost sharing for enrollee if the service or benefit has been furnished at outside their plan's area. And just one example for Part D, prescription drug beneficiaries are allowed to get a 90-day supply of their medications. There's just some limited restrictions with restricted drugs like opioids or possible shortages of a drug. Next slide, please. Even though CMS administers the Medicare program, it's the Social Security Administration that's responsible for enrolling people in Medicare. So I did thought I'd provide a slide on Social Security. So you can apply for Social Security benefits online at ssa.gov. There's also the national toll-free number. On March 17, 2020, Social Security did suspend face-to-face services in their field offices and hearing offices. However, these field offices are still operating and providing services. to find a local field office number, you can go to the ssa.gov and go to the locator, and a screen will pop up, and you can actually, there's an area where you can put in your zip code, and then you will get information on the direct line to your local office. Okay, you can start the slideshow now. One thing I kind of wanted to close with, and that's fraud. I just want to tell beneficiaries, you really have to be careful. There's fraud out there, people calling, asking for your telephone numbers, your charge numbers. Medicare will never do that. Social Security will never do it. The IRS won't do it. One of the more recent fraud schemes involves COVID-19, and that's because of people diagnosed with COVID-19. Lots of times there's contact tracing. Well, the fraudsters are out there now calling people, saying that they are, there are instances where they're saying that they're doing contact tracing for COVID-19, and they may be asking for your personal information. And a contact tracer would not do that. So just, beware, guard your Medicare card, and, if you have any questions or you think there may have been fraud, please call 1-800-MEDICARE. And be careful and stay safe. Thank you. This concludes my presentation.
It helps when I unmute myself. A couple things that have come up all the time. A lot of times people believe that Medicare will cover long-term care costs. So if they have to go to the nursing home and they can't return home, there's a thought that Medicare will cover that. Could you speak on that for a moment?
Yeah, sure. Medicare has never covered long-term care, and that's actually ever since the law was created in 1965. Medicare will cover skilled nursing care, and that's only, and this is at a nursing home, and that's only if a patient needs skilled care, and it's only for a limited period of time. And home health, Medicare home health service is limited to skilled nursing, and it's not 24-hour care. It's very limited in certain circumstances. So Medicare has never covered long-term care.
Excuse me, if I had a dime for every time someone asked that, I could have a house on Ocean Road.
Yeah.
So I think one of the things I really learned here was the cost of insulin is going down now for Medicare beneficiaries.
Yes, and it's in that if certain plans, I don't have the slide right in front of me. I think it's but the plans that offer that, which can be found through the plan finder by calling 1-800-MEDICARE. But yes, $35. It's a model, and I think it's great. It's great because insulin costs have gone up so much. It's a great opportunity for those who are on insulin.
I think that's one of those things that we've seen a lot in the news about seniors really struggling with the cost of insulin. Not just seniors, actually. I have
everyone.
I have friends whose children are on insulin, and the cost was absolutely insane. So overall, will the cost for the Medicare plans go up in 2021?
It's all it's the plan. It all depends on the plan, but
okay.
No, the overall the average the Medicare Part D plans have not gone up a lot, average, and as I said, Medicare Advantage plan has even gone down. The average for $2 a month in Rhode Island, but of course it's everyone's different, and one person can be different even from family members. I mean, one plan could be better than another plan. And the SHIP counselors are wonderful. 1-800 can also help if you have like a list of drugs and you provide that information. They can go on the Medicare Plan Finder, or you could do it yourself too, or beneficiary could do it themselves. But if you go on that and you list your drugs, it will come up with the plans, what they cover, what the cost is for your drugs. And as I said, it can be different. It can change every year, and different circumstances for different people. But if people are happy with their plans, they can stay in them also, and they'll be automatically renewed.
Yep. And I just wanted to touch on again, Medicare will cover the COVID test, even if you need it more than once.
Yes. Yes.
Excellent.
Yes. You'll need a doctor's order, but yes.
Okay. And then, God willing, we will have a vaccine for this horrible illness. Will Medicare cover that vaccine again?
Yes, Medicare will cover that vaccine, and the testing and the flu vaccine will be covered under Medicare Part B.
Excellent. Excellent. Helen, I really appreciate you coming on today. I think so many times Medicare feels very heavy and overwhelming, and it can feel like I don't know which direction to go or what gets covered. So I really appreciate you coming on today and helping clarify that for our viewers.
Well, I appreciate the opportunity to do so, and 1-800 Medicare, people can always call for assistance, and also, the state health insurance assistance programs. The counselors in Rhode Island, are there to help.
Awesome. Thank you so much, Helen. I really appreciate it.
Thank you. Thank you.
If you liked this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.